Howdy, I'm Howard Gray. I'm Assistant Athletic Director for Sports Science.
Howdy, I'm Adel Massoud, Primary Care Physician at CHI St. Joseph Health.
Here at Texas A&M, we use technology to monitor and track some of the work physically that the athletes are doing, and we use that data to give feedback to our coaches, our sports medicine staff, and our strength conditioning coaches. One of the pieces of technology that we have is Catapult. People refer to it as a GPS system. It does a lot more than that, but basically between 10 and 100 times a second, it gives a number of different elements and sources of information: distance covered, speed traveled by the athlete, cuts, impacts, all of that stuff. And this is a polar heart rate monitor that communicates actually with the Catapult unit, but measures their heartbeat every second of everything that they do physically.
A resting heart rate is your heart rate when you are at rest, and it's usually between 60 and 100 beats per minute. The target heart rate is your heart rate when you are exercising and doing aerobic exercise.
Heart rate is very beneficial for our student athletes because it measures the internal load that the body is under. With Catapult, we're able to measure the actual work that they're doing on the field of play. This is the only way to measure the actual body's response and the heart's response to that exercise. So two athletes could be doing the same speed and same distance of work, but if we don't have the heart rate monitor, we can't tell, how in shape they are, how much stress they're being put under from a cardiovascular standpoint without a heart rate monitor. If you have too much cholesterol in your blood, bad cholesterol, it can certainly clog the heart, and that leads to higher blood pressure in basically everything that you do, which puts more stress on your body than it really needs. Again, we need to stress our heart at the right time during exercise. That's what makes it stronger and in better shape. But all of the rest of the time, we want to put low stress on our heart, and cholesterol can definitely have a negative effect on that.
Cholesterol is a fatty, waxy substance that circulates through the body, and it helps with the functions of different organs. If you get too much of that, you will form plaques in your blood vessels, which will narrow the circulation and can affect the organ functions, especially in the heart, and it's a predisposing factor for heart attacks.
Anybody can get a good idea of their heart rate through a wrist-based fitness tracker. If you're looking to do some more advanced training, you may want to invest in a strap and a specific watch that gives you more detail during workouts, but great place to start is with the wrist-based fitness band.
CHI St. Joseph Health physicians can help you be evaluated, find out about your risk factors, and do whatever is needed to prevent complications.
For more information on how to keep your heart healthy, go to stayhealthyags.org.